Sore throat is one of the most common symptoms we see in clinical practice. But interestingly, in traditional Chinese medicine, there is actually no term called sore throat. Instead, ancient medical texts describe different throat conditions, such as swelling, obstruction, or heat-related inflammation, rather than a single symptom. So in traditional Chinese medicine, we don't treat the name sore throat. We treat the underlying pattern. And this difference completely changes how we diagnose and treat throat conditions. In this lecture, we'll look at how TCM understands sore throat, the major patterns involved, and the treatment strategies used in clinical practice. In traditional Chinese medicine, the concept of sore throat is not directly found in ancient texts. Instead, historical medical literature, such as the Gongyi Bogam, treasure mirror of Eastern medicine, describes various throat-related conditions. As you can see in the slide, these conditions are universally attributed to fire within the body. Terms like Ru, Shuangru, and Hou Bi were used to categorize specific diseases rather than a general term for throat pain. For instance, Ru often refers to conditions akin to tonsillitis, characterized by swelling and the appearance of white or yellowish spots on the tonsils, resembling silkworm cocoons. You can see the slide. This picture shows that. Hou Bi describes a throat impediment, signifying a blocking sensation, particularly during swallowing, often due to swelling. These ancient terms highlight a focus on the specific manifestations and underlying pathologies rather than a singular symptom of pain. Modern TCM terminology often translates sore throat into throat swelling and pain, or utilizes these classical disease names based on the diagnosis of disease rather than symptom itself. It is crucial to understand that the term sore throat itself is largely a Western medical translation, encompassing conditions like pharyngitis and tonsillitis within the TCM framework. In TCM, the throat is intimately connected to several internal organs, primarily the lung, stomach, and the kidney. The lung, governing the airway, directly influences the throat. The stomach, through its meridian, can transmit heat upwards, affecting the throat. The kidney, as the root of yin and yang, influences the throat via its meridian, which connects to the posterior aspect of the throat, as stated in the Ling Shu chapter of the Huangdi Jing. Additionally, the liver meridian also connects to the throat. Liver qi stagnation can manifest as a sensation of a foreign body or mass in the throat, causing discomfort during swallowing. While other meridians also traverse the throat, the lung, stomach, and kidney are considered the primary organs involved in sore throat pathologies. Sore throat in TCM arises from various etiological factors, often leading to heat accumulation. First, external wind heat invasion. This directly affects the lung system, leading to lung heat. The lung meridian connected to the throat then manifests symptoms. Second, dietary imbalances. Consumption of hot and spicy foods or certain medications can generate stomach heat or stomach fire, which ascends to the throat. Third, overexertion and lifestyle. Excessive physical or sexual activity can deplete kidney yin or essence, leading to deficient fire. This deficient fire then flares upwards, causing throat discomfort. In TCM, sore throat is fundamentally understood as a manifestation of heat in the throat. This heat is further categorized into two primary patterns: excessive heat and deficient heat. Let's look at the first one, excessive heat patterns. Excessive heat patterns typically involve the lung and stomach. They can be subdivided into wind heat attacking the lung and excessive interior heat. First, wind heat attacking the lung. This is often an acute onset, characterized by a sore throat that worsens with coughing and swallowing. Other symptoms include swollen throat and tonsils, hoarse voice, a red palm with a yellow coating, and a floating rapid pulse. Patients may also experience aversion to wind or cold. The second pattern is excessive interior heat, which is also known as lung and or stomach heat. This pattern can develop from an untreated wind heat invasion or arise directly from internal factors like spicy diets, certain drugs like acrid hot herbs, or emotional strain. Symptoms include severe sore throat, difficulty swallowing, thirst for cold drinks, bad breath, constipation, scanty yellow urine, and a dry cough. The tongue is typically dark red with a thick yellow dry coating or greasy yellow coating, and the pulse is flooding, big, and rapid, or forceful rapid. Let's move on to the deficient heat patterns. Deficient heat patterns are primarily associated with kidney insufficiency, often involving the lung as well. We can understand with mother-son relationship. This is usually a chronic condition with a gradual onset. So clinically, we see the pattern kidney and lung insufficiency with deficient fat. Symptoms include a chronic sore throat that worsens in the afternoon, accompanied by fatigue, dryness of the throat, hoarse voice, and a itchy or irritated throat. Other signs of insufficiency may be present, such as night sweats, and a sensation of heat in the palms, soles, and chest. The tongue is red with little or no coating, and the pulse is thin, weak, and rapid, or thready rapid, because we understand sore throat is heat, either excessive heat or deficient heat. So the fundamental principle in treating sore throat in TCM is to clear heat. However, the specific approach depends on whether the heat is excessive or deficient. For acupuncture treatment, the strategies are tailored to the identified pattern. For excessive heat patterns, the focus is on clearing heat from the lung and stomach meridians alongside local points to alleviate pain. So the main points are local points plus lung meridian points and stomach meridian points, and then large intestine meridian points, and also we add some pattern-based modifications. So the local points, we will use Ren 23 Lian Quan, which is located on the neck and which is beneficial for throat discomfort. Ren 22 Tian Tu, situated in the suprasternal fossa, which is effective for throat issues. And then we add lung meridian points. Lung 11, Shao Shang. This is a Jingwell point. We use it for bloodletting in acute sore throat to clear heat. And also we can use lung 5, Zhize. This is a Hersey point, effective for clearing lung fire and lung heat. And we have a stomach meridian point, stomach 44. This is a yin spring point. We use it to clear stomach fire. And we have a large intestine meridian point, large intestine 4, Li4, Hegu. This is actually a command point for the face and the mouth, and excellent for clearing heat and relieving pain in the face and head regions. Based on different patterns, we can add points. For wind heat pattern, we add GB20 风池, 3角5 外观 to release exterior wind. Large intestine 1, this is a Jingwell point. It can be used for bloodletting to clear heat. And long 10 Yuji, this is a yin spring point. It can clear lung heat. So for severe lung and stomach heat, you can add those 2 points together with the previous main points. Now let's move on to deficient heat patterns. The treatment aims to nourish in and clear deficient fire, primarily targeting the kidney and lung meridians. Kidney meridian points, we can select kidney 3, Tai Si, which is a Wen source point. It can tonify kidney yin, and also we can use kidney 6, Zhao Hai. This is one of the 8 confluent points. particularly effective for throat pain due to indeficiency. We can add lung meridian points, including lung 7, 裂缺. This is a lower connecting point. It can benefit the throat and clear deficient lung heat. And we can add lung 10, 余悸, to clear deficient lung fire. Here, I would like to emphasize this combination, kidney 6 and lung 7. This pair is actually the combination of the 8 confluent points. Kidney 6 together with lung 7 are commonly used for throat diseases. We can also select some additional points for nocturnal sweating. This is actually based on symptoms. We add spleen 6, 三阴交, to harmonize and tonify the 3 yin meridians. And also we can add kidney 7, 复溜, which can tonify kidney yin and stop sweating. Now let's move on to herbal medicine. When treating sore throat in traditional Chinese medicine, herbal therapy is also based on pattern differentiation. As we discussed earlier, the 3 most common patterns include wind heat attacking the lung, excess heat in the lung and stomach, indeficiency, especially lung kidney indeficiency. Let's briefly review the herbal treatment strategies for each pattern. First, wind heat attacking the lung. In this pattern, the treatment principle is to disperse wind and clear heat, while also relieving throat swelling. Commonly used herbs include 金银花, 连翘, 薄荷, 牛蒡子, 桔梗. Among these, 桔梗 is especially important because it guides the herbs to the lung and throat, helping relieve throat discomfort, also known as a guiding herb. A commonly used formula is 银翘散, which is widely used in early wind heat conditions. Second pattern is excess heat in the lung and stomach. When heat becomes more severe, especially in lung or stomach, we focus on clearing heat and resolving toxicity. Common herbs include 黄芩, 黄连, 石膏, 板蓝根, 鱼腥草, 蒲公英, etc. These herbs can help clear strong internal heat and reduce inflammation in the throat. If there are signs of severe heat, such as high fever, constipation, bad breath, red swollen throat, we may use stronger heat clearing strategies. Formulas such as 清咽利格汤 or similar modifications may be considered depending on the presentation. Lastly, lung kidney indeficiency. For chronic sore throat, especially with dryness and fatigue, we often consider indeficiency. In this case, the treatment principle is to nourish in clear deficient heat, moist and dryness. Common herbs include 麦冬、玄参、生地、沙参、石斛. These herbs help nourish lung and kidney and relieve chronic throat discomfort. The commonly used formula is 养阴清肺汤, which is often used in chronic throat dryness and deficiency. In some chronic cases, especially when symptoms persist for a long time, we may also consider phlegm accumulation or blood stasis. This is not always a primary pattern, but rather a secondary factor. If phlegm is present, we may consider adding herbs such as 泽贝母, 瓜蒌, 海浮子, etc. If there are signs of blood stasis, we may consider mild additions such as 丹参, 赤芍, 牡丹皮, etc. These additions are usually made based on the primary pattern rather than as a separate diagnosis. So in clinical practice, we usually start with the primary pattern, wind heat, excess heat, or indeficiency. And then, if necessary, we adjust the formula by adding herbs for phlegm or blood stasis. This flexible approach is one of the strengths of traditional Chinese medicine. So to summarize, in traditional Chinese medicine, sore throat is not treated as a single disease. Instead, it is understood as a manifestation of underlying imbalance, which is related to heat. This heat can be excessive heat, often involving the lung or stomach, or deficient heat, usually related to kidney insufficiency. By identifying the correct pattern, we can choose appropriate acupuncture points or herbal medicine. This is one of the key strengths of traditional Chinese medicine. We don't just treat the symptom, we treat the underlying root together. And in clinical practice, this approach often leads to more precise and individualized treatment. So next time you see a patient with sore throat, don't just think about the symptom. Think about the pattern. Ask, is it excess heat? Is it deficient heat? Is it related to lung, stomach, or kidney? Once you identify the pattern, the treatment strategy becomes much clearer.